I think what I really loved about him, he enjoys what he's doing. And
Yeah.
you're a lot better when you enjoy what you're doing, and he actually enjoys taking care of his patients who kind of become a part of his family. So that meant a lot to me.
Okay, hi, I'm Deborah Joyner.
And I'm Bobby Joyner, her very blessed husband.
Everything they tell you to do, I was already doing, and yet I had cancer.
One of the things that I remember, because everyone's aware of cancer, and when we got the news, cancer, of course, our faith in the Lord, He's seen us all the way up to right now, and I knew He wasn't going to let us, down then. And when someone asked her about, but you live so healthy, you eat so healthy, and why you? And Debbie said, why not me? I love that. You're never prepared for that, but yet we've been preparing for years for news like this because we all know we're not going to stay here forever. But I think I had to take a deep breath and say, okay, Lord, it's going to be you. Show us where to go, who to go see, what we're going to do next.
My surgeon, I was really, of course I wanted a great oncologist. I wanted this cancer taken care of. But the surgeon would have a whole lot to do with how I looked for the rest of my, whatever length of time I had. And there's no doubt in my mind that Dr. Robbins was God's gift to us. And this whole staff was, every time we came, I felt like I was coming and seeing more family. And that makes a big difference when you're going through this. When you're not getting good news, every time you go to the doctor, you get more news that's not real good. Because you get reality at the doctor's office when you're going through all those treatments and all your blood work and all that. But I would come here and get sympathy, empathy, not ooey gooey phony, but I could tell people cared, and yet I enjoyed coming here. It was just a real fun atmosphere, can you say? Professional, but fun. He was so patient with my questions and my concerns, and that helped me a lot to understand. I didn't want to just say, oh, it's okay, whatever you want to do. Can you tell me why I would do this instead of that? Or, and he was so good about that. How I had such confidence in his decisions, he was so honest with me, but yet with a kindness.
When she came home and she told me how much I was going to like Dr. Robbins, I said, well, I want to go meet him because this is my wife, and it's a touchy area. And from the moment I met you and everyone else here, and then Dr. Robbins, it's like this is a fine line between being just really super friendly and professional. You all were both. And I felt after I talked to Dr. Robbins, okay, he treated us like friends, but yet professional. And we just had total confidence in whatever he said and did. And every time we came, we left just almost like we'd been to a kind of a party, if you can call it a party. It really was a very, very warm, real feeling, and still is. And we just feel like now that they're family, and I even came here to let them work on this whole place. So I just fell in love with them, and looking back, we got closer together, and so I can tell you men, home yourself, and just love the one you loved anyway. And Debbie and I have become closer after 45 years. It's sad to say it took cancer to put us this much closer, but it has. And I think it affected my daughters. I tell you the positive part. It brought one of our daughters who lived in California and our 3 great grandchildren, not great, but they are grandchildren who are great, brought them home. She said that when I immediately heard that Mama had cancer, I knew we're moving back. Honestly, she'll say this, the whole cancer trip has been worth having them move back with us.
It was a family thing. We all just kind of did it together,
I
which
would
was
say
such a blessing.
that the faith that Debbie had, even going to our marriage 45 plus years ago, this was the test. And then when it happened, faith and then family, it just pulled the family together.
how much harder it would have been had my husband not been there for me. He travels, he tours, he's gone, but he was here for every chemo. He drove me to every appointment, with the family support and with my husband. It was just sort of like I kind of was carried through the whole process. And we were so blessed.
We come to see our daughter before the cancer, but once we found out we had cancer, then we became just enamored with the place, with the city, with the people, and we were wondering, why don't we just move up here? And so just a couple weeks ago, we moved here.
We live more for not saying we'll do that later.
It's a good point. We really live now, moment to moment. Every time we see our family's precious. And before then, we never just took it for granted, but we didn't. A lot of appreciation factor really grew during this cancer routine that we had to go through. Being in the right hands, and again, this facility here was just wonderful, and it helps to know that you're being taken care of as a person and professionally.
And yet he's such a perfectionist and such a man of excellence that you really, that helps you heal, I think, when you've been well taken care of and the best that you could get on this side of heaven.